look at that problem. Look at this. Look, I can tell you exactly why this happened and what's going on. This I see so much in my practice. I don't know why it occurs like this, but I know how it comes around. Okay, I'll explain what I mean. So you look at the beginning of this video, and do you see right above the gum, there is food on there. So the white, kind of white milky material right next to the gum, that's plaque. And some people, they just don't lick it off. So, okay, most people, they go like this.
Nice.
And they lick off the excess food from their teeth. Some people don't do that.
What?
They end up with this decay that starts right on top of the gum, right? And it eats out, it just literally scoops out the neck of the tooth. I'm not sure how this comes about, this habit, but I know that it's there, and I see that the two different classes of people, the people who lick it off, like lick their teeth clean, and people who let the food stay there, and the ones have cavities like this and the others don't. So what is the dentist gonna do? Let's take a look. So you can see the dentist kind of scooping out the decay. So he is using a slow speed burr. Why is it a slow speed? It rotates at 10,000 RPMs. We call that slow. Fast, about 200,000 RPMs is what we call in dentistry fast. Slow, 10,000. And the reason why we want to use slow, we use like gentle scooping motion. That's a special burr there. Round burr, and kind of we scoop out the decay. And you can see as he scoops out that decay, the yellow disappears and there's less of a yellow material under it. Now he's got a rubber dam in there. This is just like a big old umbrella. We don't want any fluids to go in there. When we're doing root canals, we use a whole bunch of bad chemicals. Bad for you, for soft tissues, but okay for teeth. We don't want those chemicals going down your tract, so we just put an umbrella, isolate it, good to start root canals. And as this dentist is doing root canals, he's cleaning the inside out. Wait, why do we need root canals in this scenario? Well, the decay got so deep, it touched the nerve. If we don't get the nerve out, this person is going to have an infection. It will be a disaster. They'll come in about a month with face swollen like this. You're gonna hate that dentist. So what he is doing is good forward thinking. So if your dentist tells you need a root canal, you god dang need a root canal. Do the root canal.
Do it! Just do it!
Now he's shoving pink things into the tooth. This is actually what fills the canal once the nerve is gone. It keeps the tooth sterile. Sometimes what you can see after the root canal, the teeth will go gray. Happens. Easy fix. You can either do internal bleaching or you can do crowns or veneers. In this case, I would probably opt out for crowns or veneers just because how destroyed the teeth are, but let's see what this dentist does. Okay, he is, preparing the tooth for some sort of buildup, putting posts in there. Fun fact about posts, that they do strengthen the tooth and they do keep the core in there. Is it necessary for this particular case? I'm not super sure, but okay. It doesn't hurt. It's fine. It's fine. I see what he's doing. Okay, so instead of doing the whole crown thingamajig, he is building up these teeth in composite. This is a good way to go about it. Not my personal choice, just because I cannot make the composites look as natural and as beautiful as crowns. And if I'm putting something on your teeth, it better last 30 years. I believe crowns last 30 years. Composites, maybe not so much. So, fun fact, I do have patients who are wearing their front crowns, and I didn't do them. This was like a long time ago, but they're still there, and the patient's like 80 years old, and they got it when they were 25. So crowns can stick around for a long time, and this is the type of dentistry that I want to be done for my patients. So once they're done, they're done. They don't have to ever come back to that problem anymore. Check out what he's doing right now. This is so awesome because he is doing some characterizations. You can see he's using that white stone and it's creating these little divots. So your teeth are never flat. They're never just flat or round or whatever. They have these grooves and anatomies, even the front teeth. This is what gives the teeth kind of that beautiful shape. They're fun to look at, yeah? So this is what this dentist is trying to simulate, and he's doing a good job. He's a very artistic guy. The green things that are sticking out, that's not broccoli. That's not anything that he ate, that the patient ate.
What the hell is even that?
This is actually cord that we pack around the gum so the gum doesn't encroach onto the restoration. So we have a side of a tooth and the gum is right here. We want to lower the gum just a bit temporarily. So we put a little bit of cord in there and that shoves the gum down a little bit. So we can do some work here. Once we pull the cord out, the gum like goes and bounces back up. So it was here, we did our restoration and we pull the cord out, the gum kind of and bounces back up. And that's what you're seeing here. He's about to pull out the cord. That's always satisfying. Oh yeah. Oh yeah, baby. Just So you can see here, the 4 front teeth are finished. There's some more work to be done, but at least the dentist handled the big question of the day. How do we get the front teeth back in here? And he did that beautifully. This is good dentistry. He's a good dentist.